But now when I read, I felt like there is nothing much. Still.
Okay.
So we'll go through the individual drugs in the spider group.
Okay.
You're seeing the document now.
Yes.
Okay. So usually for as like we did the other drugs, the carbon group, and now later we will be doing the natrum group, kali group. The as like I made you to differentiate between the different systems. Uh, Usually that kind of question is followed for those groups in which the medicines really have so much characteristic features. But when it
Okay.
comes to the lag group, I didn't compare the medicines in between the within the group. And even
Mhm.
in this one, we won't be comparing the medicines within the group because more out of these all medicines, you have got six to study. But I added one more, Tarantula cubensis. Actually got only very small paragraph to remember, but it is clinically important. That's why I included, even though it was not in your syllabus.
Mhm.
Um, then, so the medicines are actually very small in number, only one or two. So it is not very easy to differentiate. Not easy. It is very like it. It usually they ask if for differentiation, then that is
Mhm.
in the PG level, like when we go for a MD materia medica, like that. In the BHMS level, we don't go for comparison. So here also, I'm just dealing with the individual drugs. And the question pattern, if it comes in comparative materia medica, the usual thing will be, even in case of this one also, lacusis, I mean the ophidia group, they will be asking you the common characteristic feature of a particular group, maybe even spider, the characteristic common features, the members or the drugs which are present in that group, and then to explain one of the medicine. That would be how usually the question will be asked. But when if it is this one, what is that? Ophidia. In Ophidia, there are two important remedies, that is lachesis and also Crotalus horridus, and
Mhm.
both bring about hemorrhage, and they have septic features. And the septic features of lachesis and Crotalus horridus are to be compared. So if it is Ophidia that is asked, usually it can be asked like the characteristic feature, the common features. All the family medicines, it usually starts with the common features. You have to describe the common features, and then the members, their common name, that is the, and then one adjoint question. So in case of Ophidia, it can be like to describe one of the drug. They can ask even Vipera, they can ask anything, or lachesis, or even the question Crotalus horridus. They can be asking, that can be asked, or individually one drug alone, or a comparison of the blood poisoning symptoms of Crotalus horridus and lachesis. So to compare that, that will be the usual way. But anyway, in case of spider group, there won't be any comparisons within the drugs in the BHMS level, because this differentiation is so in minor points, certain sites and all, certain modalities. So it is usually kept for in a MD level, not over here. So here also, I'm just going with the individual drugs and nothing more. Oh, but before to that, we have something, na? I think we did this doctrine of signature. The
Uh-huh.
person is always, and then we reach the common sphere of action. Maybe mind also did we do?
We did until the picture.
Okay.
Yeah.
So, yeah. So here we have the common spheres, their action in the mental sphere. So in
Mhm.
all the spiders, we see nervous symptoms. When we go to the individual drugs also, we can see there is, the persons are quite nervous in nature. There will be nervous affections, and many of the drugs will be manifesting as their involuntary jerky movements or chorea. So that will be a physical manifestation of that nervousness. There can be mental manifestations, including the anxiety, trembling, restlessness, and we can connect this type of nervous symptoms in the mental level to the poisoning also. Because if they are getting poisoned by the spider snakes, I mean the spider drugs, bitten by that, they will be having some mentally anxiety also. Am I going to die? All those anxiety. So even in the proving, we get that in the constitution itself, we get that. So the person can be mentally very broken down constitution with anxiety, numbness, sleep issues, change of appetite, social withdrawal, all this. So even though when we say that all the spider remedies are very um, mm, are not as constitutional like laxative or some pulsatilla, natramute, like that. We don't say, but still, this medicine is very much good if we have to give it for this jerky movements, chorea, etc. So the nervous symptoms are highly characteristic for this drug, the spider remedies. In the CNS, they act on the motor nerves. And motor nerves means either it can be paralysis or the involuntary movements. And here it will be the involuntary movements. So chorea, hysteria, they will be producing. And also there will be hyperesthesia, where there is extreme or highly sensitiveness with convulsions. So anything where there is an exaggerated motion, involuntary motions, we can think about spider remedies. A lot of remedies others like laxative can be given, agaricus, singamet. These are other remedies for chorea, but when you have a case, because we, in case of children who have complaints with cerebellum, or the motor nerves, the LMN lesion, or the UMN, where the central nervous system or the cerebellum is affected and the motor functions are affected. If they're coming with an involuntary movement, this chorea and all, a group of remedies which you can initially think about will be spider remedies. And if you could find a medicine from that group, it will be well suiting and it will be deeper enough to act. And then if it is not only, you need to go to other drugs. So this feature of their nervousness and the action on motor nerves is very important. Even this medicine is important for CVS. A most important remedy in case of CVS will be the spider, which is highly poisonous among the group, and that is Lactodactylus mactans. Lactodactylus mactans, when we go to the individual drug, we will see that it is very much indicated for the conditions of angina pectoris or the angina, the heart attack, MI pain. They have the symptoms with that, similar to that Lactodactylus. So it is the Lactodactylus which is having the CVS symptoms, acting on heart and blood vessels, which causes its constriction. So there can be degeneration, destruction of blood vessels, and also it can act on the papillary muscles of the heart, producing murmurs. So CVS blood vessels, they do have action, uh, and kidney, they can act on kidney and result in albuminuria and hematuria. But this is more or less they have kept as a common feature, if this has been the. But when we take the individual remedy, we don't get any individual remedy specifically acting on kidney. But we do have some medicine that is suited for gonorrhea. We have some remedy which will be acting for gonorrhea and syphilis, but not exactly the glomerular nephritis, but still. Then in skin, skin is very important. It can produce vesicular eruptions of a furuncle, carbuncle, boils, and everything will be having burning pain. So these are the common features in the mind: the nervous affection, the nervous sensitiveness. So manifesting in the what is that? The mind symptoms, the anxiety, trembling, broken down constitution, and also in the physical level as involuntary jerky movements or hyperesthesia. They will be extremely sensitive to even the smallest touch. And then the action can be also in the CVS, especially producing the symptoms of angina. And then skin will be more important than that of kidney, though there are medicines that is indicated for gonorrhea and all. Then the mental symptoms, nervousness, we told, anxiety and tension. Uh, in the anxiety, we can see that the mind always goes into a tantrum, and they become rage easily or become very angry, tearing clothes, violence, etc. They see animal, monsters, insects, and ghosts. Also see strangers in a room, because this remedy is very good for hysterical conditions. So whatever we learn about the belladonna, stramonium, hyoscyamus, they are also good for hysteria or the a violent maniacal nature. So even that we can see in a spider group. But if you ask me the intensity will be much more in case of bell um, than stramonium hyoscyamus when compared to the spider group. The spider will be, they will be having, but when comparison, it should be lesser, the hysteria in them. Then another feature is time passes too quickly. Then sociability, because these spider people usually will be very social, friendly, and jovial. They're very fashionable, aristocratic, and why they do this is they want to possess power. So they want to influence people, show them that they are very high-fi, and hence they try to become very sociable in nature. And here also, they are social, friendly, jovial, and the main intention is to get a power, so like a politician nature. So they will be feigning most of it. It's not that they are a true friend or truly social something. We see that somewhere that I have mentioned, they are actually very cunning, yeah, very cunning, mischievous persons. Because when we were saying about the spiders, we already told that in the animal sphere, because they don't actually go to catch a prey. They just make a web, they spin a web, and then wait for the prey to come to them. So they're very cunning and deceptive in nature. So when we say they are sociable, this can be also because of their love to possess power. Not that they are very truly loving or affectionate and sociable like any other phosphorus, tuberculinum, causticum, not of that social nature. Uh, so emotionally, the constellation causes weeping, like constellation causing aggravation, which we see in Natramure and Ignatia. We can see over here also. The least contradiction affects her, and a lot of medicines we have for that, Oramet, Nux vomica, Natramure, a lot of remedies. And she broods over her troubles. Mood changes with great rapidity. She laughs and then quickly bursts into tears. And when we say this symptom, the medicine, probably if it had come into your mind, it would be Ignatia, Sepia, etc. Because those two remedies also sit and brood over all the troubles. And in Ignatia and Sepia also we have hysteria. So, but the constitution is totally different. In Ignatia, we have seen that the lady will be highly intellectual. She will be having complaints from unrequited love, but she sits and broods, and she contemplates both suicide, um, but not exactly suicide. She's not that one. But mostly it will be an acute manifestation of hysteria, and also involuntary sighing will be the, she'll be brooding, weeping, such, and that alternate nature we have seen, or the that is that, um, not exactly alternation. Uh, we have seen the symptoms that in case of Ignatia we have uh, both the natures like the remedy of great contradictions. So that is the feature of Ignatia. And when we go to Sepia, Sepia is actually having a very indifferent nature because of all these long continued emotions, sadness. They have gone into a indifferent nature. But in both of them, they are not deceptive or very cunning in nature, but this spider group are. So, though they have similarity with regard to ignatia, sepia, and natramute, these people basically they have a cunning nature. And all the three remedies we told, that is sepia, ignatia, and natramute, they don't have this involuntary or jerky movements. Whatever their hysteria, it is manifested in their mental sphere, but they don't have that jerky movements. But this one, they will be having some or the other jerky movements. That nervousness will be manifested. So a comparison, but that I just told in case if you are ever practicing and then you need. Otherwise, for exam purpose, it won't be coming that deeper. Then hysterical, I already told, but there is one importance for the hysteria. They show that hysteria only when people are observing them, and if they are no one to observe, they will be sitting silent. So that also shows their cunning nature. So that is the basic nature of spider people. They will be very cunning in nature. Uh, then they are fearless, they are courageous, brave enough to meet the challenges of life. No wonder that they want to become politicians or love power. Then there is excitement with singing, dancing, and weeping. They not only imagine themselves as sick, but also pretend sick when they are not, still showing their feigning type of cunning, deceptive nature. And these people, they do have amelioration from dancing that we'll see in the individual drugs. Then in the physical symptoms, the action of the drug is twofold. One, that is, it can cause poisoning of the blood, and that's why I told you it is a very good remedy for all the boil, furuncle, carbuncle, abscess, whatever the skin, subcutaneous tissues affection, the septic condition. This is a very good remedy. Then they also act prominently on the nerve system. So it is mainly the blood, the CVS and the CNS, they are acting. So that produces the spasmodic diseases like chorea and hysteria. If it is acting in the nervous system and in the blood, they produces the symptoms of carbuncle, furuncle, and all the boils, abscess, etc. Most of the spider remedies develop a constitutional state or a dysplasia that is going deeper into the body, so well suited for chronic and deep-seated disease. So even though when we are going for individual drugs, you see that only two main drugs you will be studying over there, that is tarantula and also theridion. But in itself, it can be a constitutional remedy. Then there is periodicity, marked periodicity. Even in the poisoning, I don't know whether you remember when I was taking tarantula for you in the last semester, I have told you a case where a farmer was bitten by this tarantula, and he was actually treated, and he was saved actually, but he would develop the symptoms next year or the consecutive year around the time when he had got bitten. So there is a periodicity, mark periodicity. Even it was just poisoning, it was shown in the history, the literature it was written. So this periodicity we have got even in our proving. So periodicity is highly characteristic. And then septic condition, I already explained you. Palpitation also we saw it is acting in the heart. There is a sudden thumping in the heart, sensation as if heart is compressed, and this is everything relating mainly to the angina pectoris. Then there are medicines which act on the sexual sphere. They are highly sexually desire is highly increased. There will be violent, uncontrollable desire, nymphomania, violent itching of the genitalia. However, coitus is aggravating all these symptoms. So that is the kind of physical manifestation they have. Then another one is their hypersensitiveness, which we already discussed because their hyperesthesia, we saw that their nerves are highly sensitive, and their sensitivity it is manifested in some other way, like a single touch is enough. Even the fingertips will be getting very much excited. Hyperesthetic or exaggerated sensation they can feel in the tip of the fingers also, because even in the tip of that fingers or all the parts of the body where there is large accumulation of the nerves, the terminal of the nerves, it will be extremely, the sensations are exaggerated. And in other manifestation for them, this is another important symptom which is seen in actually Theridion. Every sound penetrates through their teeth or through the whole body. Whatever, because they're highly sensitive, even the slightest voice, they feel that it is going through their teeth or it is actually going through their body. And that is a general aggravation for many of their complaints. We'll see that when we go to the drug in detail. Then the spine is extremely sensitive. We see the hyperesthesia over there also. And how we explain that hyperesthesia in spine is, if we are going to touch the spinal region, the person will be having, in case of Theridion, they can't sit like this, like touching on the chair. They actually will doesn't want anything to touch their spinal cord or the vertebra, and so they will be sitting like this without any contact. So that pressure also will be a aggravation. They don't want any touch. It will be highly sensitive. And that is in case of Theridion. And when we go to Tarantula, we see that if we are going to touch the spine of that person, I mean, in that vertebral, in the back area, it will produce a spasmodic pain in his chest and heart region. So this hyperesthesia is a characteristic feature, especially in the tip of the fingers and also in the spinal region. Then they have vertigo on closing eyes from any kind of motion, ship sickness, etc. This we will deal in Theridion. Uh, then their desire for raw food, cold drink, banana, alcoholic drinks, and tobacco. I don't want you to remember all these things. Maybe you can just remember cold drinks because they're actually. Uh, but there is difference in cold drinks also. No need. With some drugs, they have an open air amelioration and some they have warmth amelioration. But no need to go for this confusing symptom. Go for tobacco. Most of their complaints, the spider people, their complaints are ameliorated by smoking. They have that strange symptom. So they have a desire and their complaints are ameliorated by tobacco. We can see that they have cough, which is ameliorated by smoking. Then there is aversion for all these things. But still, it is not highly characteristic. Characteristic will be the desire and the amelioration from tobacco. General modalities, they have aggravation and amelioration. Least touch, because we saw that they're highly sensitive. So least touch, least motion is aggravation. Night there is aggravation, sleep there is aggravation, and this symptom, the aggravation in night, aggravation in sleep, and even periodicity, we see in another drug. You know, another characteristic drug where there is night aggravation, sleep aggravation, and periodicity. Another animal drug, or animal group.
Nine things. We have all three. Is it?
Hmm. Hmm.
Mm, Is it the snake remedy?
Yeah,
Lachesis?
Lachesis. Yes,
Yeah.
Lachesis. So we see that they have a lot of similarity with Lachesis actually because of this hypersensitivity we see in Lachesis, some of the mental symptoms we can see in Lachesis, the periodicity, aggravation in night or from sleep we can see in Lachesis. So when we go to the individual drug, we can see comparisons between the spider and the lac or the snake remedies.
Okay.
Because even in lachesis, they produce the nervous complaints or CNS complaints. Then they are also good for, as I told you, the blood poisoning. So we, in case of spider, also there is blood poisoning, And lacuses or the snake remedies are also good for angina or the heart complaints, but not that severe angina or the acute angina, but mostly the chronic type, where there is a hypertrophy of heart. And the best medicine that will act will be nausea for the chronic complaints, valvular lesions, hypertrophy of the heart, nausea. And when we go to vipera, vipera is mainly affecting the veins. So um, the disease which one is that Farah that which affects the TAO symptoms, thromboangiitis obliterans in the feet. Um, and there is another name. Did you understand TAO? Thromboangiitis obliterans.
Yes.
Those symptoms and the there is another name for that condition. What is that name, Farah? Mm, the lymphangitis. Uh, in the lower limbs,
Lymphocytes? Mm,
which can further develop or result in the complication of pulmonary infarction, the
um,
emboli which is moving. Oh, I'm getting all the symptoms but not the name of the disease. The embolism can happen from that, yeah, DVT, deep vein thrombosis.
oh, okay.
So that condition also we have the medicine which is Vipora, that is very best. So the snake remedies also have this action on CNS and CVS, also the spider remedies, and then they have the symptom this aggravation night sleep periodicity. Uh,
So,
so amelioration it will be open air, music and dance, and also warmth. Now we go to the individual drugs. We start with the Theridion. And as you see, it is very orange color, so the common name will be orange spider. Preparation of all the spider remedy is by tincture of the living spider, except for Tila areniarum, in which we take the medicine from the spider web. We just triturate it and we take Tila areniarum. Otherwise, all the other remedies, it is the trituration of that live spider and then taking its medicine. The prover is herring in case of Theridion, and the venom is very, very poisonous. The ailments from the seasickness, which we saw above, we'll discuss over here. So there is sickness from traveling in the sea, riding in any carriage. It can be a present day, we can consider it as a train or a car. And in the earlier times, we could connect it to they were usually using the horse carriage. So traveling or riding in that carriage was problem. And sea traveling, we have other remedies, Paramet, Tabacum, and Coculus. However, if I say you specifically, the sea traveling or the
mhm,
seasickness or the traveling by ship, it is one of the important remedy in that will be tobacco and this one, the
okay.
radio. So if even now there is people who are going by ships and all. So if they have some symptoms, tobacco would be a very good remedy. I have given tobacco. I myself have taken tobacco when I was
Mhm,
going for, and it was acting actually. And this one actually, Theridion, I didn't know because I traveled when I was studying second year of
okay.
BHMS. So at that time, I didn't know about the radio. Okay, I knew only I studied only about tobacco, but that was acting. And after that, I always because it was acting for me, I never tried to give the radio or the snake reply. I always give tobacco because it's all told that whenever we are taking an animal remedy or no sort, we need to be very careful. We need to be very sure that the medicine is indicated. Otherwise, just stick on with the plant remedy. So I just
Mm,
stick on with tobacco. Then this one, Cochless. Cochless, recently I tried, but not for sea traveling. It is for a baby. I tried. Baby means now she is of 5 years old.
uh-huh.
So she had this symptom of this um,
Motion sickness?
traveling sickness. Yeah,
Okay.
the motion sickness. Any kind of vehicle. except for the flight maybe, but any, even the cab is or the bus, train, everything is difficult for her. So I gave her Coculus. I was very not at all sure whether it would act or not, because the child had the problem even when she was a baby, and now she is 5 or 6 years old. So when I gave the medicine also, I told some extra general measures like not to keep her stomach too empty or too full, something very light, easily digestible. So I gave such diet restriction also, nothing like curd, milk and all, so that it can get something that produce acidic nature, uh, like a bland diet. That's what I told, and then I told them to give Cocles, and it worked actually. So, and then I told them also, I don't have any guarantee. I'm never given, but I'm just trying with that. So it was my relatives actually. That's why I told, okay, I'm not given anyone else. But the medicine actually worked because they were going for actually a 1 week tour. It was not 1 day journey. The whole family was going for a 1 week tour, and they wanted this medicine. So whole 1 week, she showed some kind of discomfort for the first few days, but always they gave the medicine, and she never had this vomiting or something. Otherwise, she
Did
couldn't even
you
travel.
give? Oh, sorry, Miss. I just want to ask if you had taken the tibecum or the calculus like before they get the symptoms or during the symptoms.
Coculus for the baby, I told to give earlier because she is a
Oh,
baby. The
okay.
symptoms will be coming. She won't be saying, I'm feeling difficulty. And if it is the baby, whole the family is going, and that too 1 week. So once the child vomited means, then the condition won't be with us. Like if you had traveled with a baby, once the baby got sick means that the whole trip has gone. So for that, I didn't want to take any risk and told her
Yeah.
immediately after the food, give the medicine. And I was actually saying them to repeat frequently, because I have never given the someone this medicine for the traveling sickness. And once I gave to an adult, but it failed actually to an
Oh,
adult when I gave Coculus. But to this baby, when they told, it was actually a trial and error also, but it worked. And I was saying that frequent repetition, like in every 1 hour, I told to take 2 pills each, two
okay.
small globule. That was the prescription I gave. But in case of mine, because I'm having a control on myself, I knew the difficulty. I took it only when the symptom developed. I took the medicine with me, and I just got into the ship because I never had this traveling sickness in any way. So I was very confident that I'm not going to have. But in the ship, what I had was, I was not vomiting. I was not feeling nausea, but my symptom was intense headache. Intense headache means as if the head was bursting. That was the kind of headache I was feeling.
Wow.
So when it started, I actually had to come, because it was already told to me not to book a cabin. So we had actually booked a, you know, open deck. Uh, Open deck means we don't have a cabin.
Okay.
It's not a cruise ship and all. It was just going to an island. So
Uh-huh.
my sister was working over there. If you know Lakshadweep Island, have you heard Lakshadweep Island?
No.
Okay, so that's in the Arabian Sea. So my sister works over
Okay.
there. So
Oh,
I was actually traveling by ship to that area. So my brother
okay.
also was there. So because the cabin is still in the deeper level, near to, I mean, even submerged in the water, the lower level, my
Uh-huh.
brother told that don't take the cabin ticket. We'll go for the open. We'll stay in the open. And then we can sit in the open deck because it is a passenger ship, not the costly cruise and all. So we had the option to travel, I mean, sit anywhere. So we just took the casual ticket where we will be made to sit in a open area within the ship. But once the ship reached that completely that ocean area or the sea area, when it was completely away from the land, I had this difficulty. And then I wanted to go to the open area, the deck. I mean, the deck, and that open air was ameliorating me. But I didn't have nausea, vomiting, nothing I had. No GIT symptoms. It was only the severe headache I was feeling. And I felt a kind of amelioration when I came to open air. And that's the feature. If you take tabacum, the Borico keynote, you will see in case of tabacum, there is a headache also, vertigo also, which is ameliorated by open air.
I see.
So I didn't go much details when I was taking tobacco. I told you I went when I was doing second BHM, so I had only preliminary knowledge. I knew that tobacco is good for seasickness, so I just took tobacco. And when the headache started, I went and took 2 pills or 3 pills, not much. When it comes to me, we can control the medication. So I just took 2 or 3, and then I was already feeling amelioration also when I came to open air. And that whole night I slept over there in the open air. I didn't sleep actually. I just lied over there, no, laid over there, and was seeing the starry sky and all. Okay, anyway,
Wow.
so tobacco worked at that time. Mm, and cockless in this case. But just only one dose I took. When I was returning, I didn't take any medicine at all. That was only in the first trip I had to take. Otherwise, no.
Okay.
Yeah. Then when other one I put it here is Ferromet, but Ferromet more than a sea traveling or a seasickness, they have more a problem because of when they are crossing the bridge, or they are walking, and underneath there is a stream or water body that is flowing. So it is the flowing water that vision is their problem, and it is more related to their anemic nature, that vertigo. To that, that's something that is moving, and then the height, the anemic people, it's usually a manifestation of anemia. If the people are saying that they have a scare of height, not just scare of height, when they are looking down, especially things are moving, if they feel like they have a vertigo, we ask them to do a blood test. Most of them will be showing anemia also. The hemoglobin reduced level or the reduced oxygen level, it is producing that kind of anemia. So when they see something that is flowing down, they have this sensation of falling down. So sea traveling, in when I put Faramet over here, it is not exactly that it is good for a ship sickness or something. It is more the flowing water is problem for Faramet.
Okay.
And this symptom we can see in lysinum also. But when it is exactly the ship sickness, that motion or traveling within the ship that is causing the problem, tobacco and theridion would be good choice. And from practice, I would say tobacco. Then
Okay.
riding carriage, I told you the washing clothes, and maybe because of the water touching, I don't know, they have this nausea and vomiting from washing clothes. Anyway, the thing will be most importantly sea traveling and riding. In the mind, they have hysteria, and hysteria, it is manifested as time passes too quickly. We have some comparative remedies when the time is passing too slowly. We have cannabis indica, agenda nitricum, or nux moscata. And in hysteria, they can also manifest it as hilarity, or they are always laughing, talkative, and they have some strange sensation as if the head doesn't belong to her, and she could remove the head from her neck, and all those crazy things. That's how her hysteria is manifested. And another important symptom will be as if a child is present inside her womb, like that pseudo pregnant or pseudocysis. She have such a thought. Child is bounding in the body, and that symptom we can see in other drugs. These are the big list of similar drugs. I mean, not similar drugs, the drugs which are having similar symptom, that there is something alive present in the stomach, or that pseudo pregnancy syndrome. So Crocus sativus, Tuja, Sabadilla, sulfur, and Nux mosquita. These are the remedies. So hysteria, these two will be the most important symptoms. The time passing too quickly, and as if a child that is present inside the body. Then for the guiding symptoms, in case of theridion, they have got two keynote symptom, and this we can present, this we can see throughout the drugs also. So the first symptom will be the extreme sensitiveness to noise, the hypersensitiveness. I told you, they feel like the sound penetrates through their teeth. Either it is moving through their teeth because of their highly sensitive nature. It's not that the teeth is having problem, there can be tooth problem also, because this is a very good remedy for caries. So
Okay.
teeth hollowness, etc. And when the teeth is hollow, they feel like that extreme sensitive, that something is piercing through the teeth. That can be the. Otherwise, it can also be like the sound is penetrating through their whole body, and this is very highly characteristic. We'll see how they manifest. We can see that the sensitiveness is that extensive. There is no need of any sound. Even the vibration is enough to move through their body. So even the jar of a step, like the person is sitting over there and someone is moving near to that person, the symptoms will be aggravated. We'll see that. Then even the riding in a carriage, in a boat, everything, that slightest motion, that vibration, even if it is not producing sound, is sensitive, but even that vibration could be passing right through their body, increasing almost all their complaints. So this extreme sensitiveness to noise is a keynote remedy. In case of seasickness, they close their eyes to get rid of motion of the vessel, and then they grow deathly sick. Which means I told you that they are having seasickness, and the problem is that movement is actually their problem. When they are moving, that motion, that sudden motion, that causes their difficulty, and then they feel like to close their eyes so that they don't have to see the moving or that motion. But when that happens, their second symptom is the second characteristic feature. We told that they are having two features. The second
Mhm.
symptom of the theridion is aggravation from closing eyes. So when the lady, the nervous lady who is having a seasickness, she has
Mhm.
complaints from seeing that motion, or the vehicle
Yes.
is moving and the things are also moving along with her. So to avoid that motion, she closes her eyes. But her other complaint is aggravation from closing of eyes, and that produces all this nausea, vomiting, everything, and even vertigo in that woman. So both the thing, to avoid that motion, she closes the eyes, and closing the eyes produces other set of symptoms. So that's why I just told here, connected with the second keynote feature, that is closing the eyes producing the symptoms.
Mhm.
Then this symptom, that the sound is passing through the body, that can be seen in case of bony structures as well as the nervous organs, they enclose it. So they can feel the sound is passing through the tooth, and I told it can be connected to the caries, and even this body, it can pass through, and also any bony structure in which some nervous organ have been enclosed. And when we say that, the first organ that will come into our mind will be spinal cord, vertebral column and spinal cord, the bony
Okay.
structure and the nervous thing that is enclosed, and also even the scalp, and also ear, the labyrinthine ear complaints.
Mhm.
So some that also includes the fluid and the nervous structures. So all these structures will be affected. And how they manifest is that extreme sensitiveness, the diseases of the spinal cord. So any degeneration of the spinal cord, we already saw that these drugs, they have extreme sensitiveness of the spinal cord, the vertebral column. So any diseases of the spinal cord or the bones. So bones can be caries, necrosis, Crofilus diseases, rachitis or rickets, etc. Theridion is a very good remedy. And also, because it is bony structure and nervous organ, even oral or labyrinthine, the ear, the inner ear, affections can be there. So this is a very good remedy for Meniere's disease. And in case of Meniere's disease, we have these symptoms, especially vertigo, tinnitus or tinnitus, how it is pronounced?
I'm not sure actually.
and just continue with tinnitus. So, what
Okay.
I know, tinnitus and hearing difficulty. It can be complete deafness or just some hearing difficulty. That's the feature, and also balancing. And all these symptoms we can see in the drug also. Though we gave the name Linnaeus disease, we have already seen that the person is having vertigo. We already saw that the vertigo, the motion sickness, and tinnitus. Everything can be connected to their extreme sensitiveness. So from that simple symptom that the sound is highly sensitive, it moves through the bones, the bony structure and the nervous organ enclosed in it, and also through the teeth. We can physically connect it to many of the diseases like the decayed or hollow tooth, caries, the bone necrosis, scrofulous conditions, and even Meniere's disease. And even in headache, later in the particular symptoms, we see that. Then in scrofullosis, when the best remedies fail to relieve, that's how it is given. In the scrofullosis after sulfur, calcarea, and lycopodium. Sulfur, calcarea, lycopodium, we have already discussed in our initial classes. They have a chain. They are a chain of cognate remedies we call. It has to be gone in a sequence. So SCL, that is the in case of psoric miasm, the deep one, when it is highly constitutional or deep dyscrasias, if we are giving sulfur, usually we follow, if the symptoms are indicated, we follow this pathway, sulfur, calcarea, lycopodium. So in case the patient is having scrofullosis is a condition where there is even lymph node enlargement, TB
Okay.
with lymph node enlargement. So in that condition, we know that sulfur, calcarea, TB and lymph node enlargement means it will come to the tubercular myasm, the psoric
Okay.
and the psychotic. So even that miasm, we have this three anti-psorics to cover. So
Mm-hmm.
when they have failed or when they have done only half the work, it is told that we can think about Theridion. And it actually is the medicine when the best remedies fail to relieve. So that's the importance of Theridion. When we otherwise say Theridion, though we mentioned about the constitution, we clearly don't get such a polycrust type of symptoms in case of Theridion when compared to sulfur, calcarea, and lycopodium. But still, Theridion, though we don't have a set of head to foot symptoms like other three drugs, Theridion can go deeper into the body and then remove the symptom. So that's what the next explanation that was given by Clark. It does not seem to affect the external scrofulous symptoms, that the lymphadenopathy is destruction. We don't see much externally, it is doing some wonders. But what this medicine actually do is they go to the root of the evil and effectually destroys the cause of the disease from the interior. From the interior, it can uh, destroy that miasmatic tendency
Mm-hmm.
even. So that's the importance of scrofullosis. So anything where there is a caries necrosis condition, theridion is a very good remedy. So otherwise, when we say about caries or necrosis, the important remedy which will come into our mind will be usually phosphorus, then all the acid remedies because destruction is highly characteristic, especially fluoric acid, that type merc salt. All are these are the medicines which come into our mind, but even Theridion is as good as each of them or even better. That's how they say.
Okay.
Externally, we don't see much manifestations, but this is a medicine that can go deeper into the body. And because of this scrofulous action or the bone destruction, this can be also a good remedy for ozena, whether there is a abscess or the nasal cavity being, the nasal bone being destructed or its necrosis. So this is a good remedy for ozena. And the discharge from the nose, when there is nosena, there is, so not nosena, when there is ozena. When there is ozena, it is actually the destruction of the um, uh, nose, the nasal cavity, the nasal septum, and very offensive nasal discharge will be coming from there. So in those conditions also we can think about theridion. And it is indispensable in cases of phthisis florida. You know what is Thysis florida?
Mm-mm.
What is Thysis?
Isis is um isn't that uh tuberculosis?
Yes. So just make a guess. Thysis florida. Let's make a guess.
What is Florida?
Florid means fully blonde, medically.
Oh, okay.
FLA, florid, when we use medically, is fully blonde. So something that is becoming very severe, fully blonde in a very short time. In those conditions, we use medically the term florid.
Oh,
So
okay.
it is, I'm not remembering any other condition because it's a old terminology, medical terminology, but not just used by homeopathic. Even the allopathic literature they use. But now I'm not remembering any condition with name Florida.
Mm-hmm.
But if you see some old diseases or in the old literature, you see that term, florid can be a term used with any condition, any disease like this. Uh, when that term comes, it just indicates that it is a very full blown, very serious condition, and it is becoming full blown and very serious in a very short time. So, in the
Oh,
initial literature, medical literature, they use that term to indicate. So, whenever you see that term florid, it
mm-hmm.
means a full blown condition, very severe, and it took only few days to
I
get it
see.
to that complication. So, that
Okay.
is Isis florida. So tuberculosis, which have been fully grown, we can give this medicine. So that all these symptoms show the extent to which the radion can act. All the symptoms that we told in the spinal cord, its destruction, the Meniere's disease, which means in the inner ear, the labyrinthine being affected. Then we see with the nasal cavity, the ozonic condition. Uh, then this one, TB, which is fully blown,
Mm-hmm.
all those conditions, the radion can go deeper. That's how it's so deeper. Even though we don't have a particular constitution, like, but we do have the mind symptoms. We do have a physical symptom, but still, when you see, we see that the radion is more or less like a. We don't see as a full person like sulfur. We don't imagine a constitution, but still they have a very deeper action. And the second feature will be aggravation from closing eyes. And these two symptoms, that is the sensitiveness to the voice or to the noise, and also aggravation from closing eyes, we can see in vertigo, headache, and stomach ailments. So, stomach ailments mostly the nausea and other gastric complaints, mostly nausea. We can see these two symptoms. So that is why we connected the stomach complaints or the nausea, closing eyes, the vertigo, etc., to the seasickness. So seasickness, motion is their problem. They close their eyes to avoid seeing the motion, but then that closing eyes, it can produce vertigo and nausea, which means the sickness is making her deathly sick. Deathly sick means deathly nauseating. So that will be the, and this is a comparison actually what I have put in bracket. We had to study this for Viva, but because you won't be having Viva, it can be asked for MCQ. I don't know, it
Okay.
depends at that time. But this is very interesting to learn, and that's why it used to be a Viva question for us. So vertigo. In case of Theridion, we saw that it is on closing the eyes, and we have other remedies, that is lacusis and thuja. So lacusis also, we already saw that they are having night aggravation, sleep deprivation. So what is actually happening is at the night also, basically if you are trying to connect, we are closing the eyes.
Yeah.
Yeah, so, but in lacusis, it's not actually the closing the eyes. It's the night time that is their problem. Night lying down is their problem. But just for our sake of memory, we can connect this closing eyes. Okay, the sleep time. This one, lacusis also close eyes. So closing eyes, it produces vertigo in case of lacusis, theridion, and thuja. And then we have opening eyes, vertigo on opening eyes, and that will be the next remedy for the seasickness, that is tobacco. And if vertigo is there on looking up, it is pulsatile and silencia. And if it is looking down, it will be calmia and spigelia. So this used to be when usually, as I told you, when some teachers ask us describe theridion, and then the moment we say vertigo on closing eyes, they will be waiting. So what is the remedy for this one? Vertigo
Oh,
opening, yeah, closing eyes. Uh, that used to be. So I just put it over there in case for your practical purpose, if that is required. So this remedy, the mostly affected side will be left-sided in case of theridion. But we have spider remedies which are actually right-sided affections also. And then generally all the symptoms will be having trembling, anxiety, cold, and weakness. And these are the symptoms when we usually find in the if the case the patient had a spider poisoning. So that spider poisoning symptoms also we can see when the patient is having some or the other complaint. In the proving also we got that, but not that important. It will be the three symptoms that is highly important. And this extreme nervous condition, it will be manifested especially during puberty, pregnancy, and climatic years. So in the case of a female, we say that this is the three important milestones, especially in the menstrual or the reproductive life cycle of a woman if we are taking. These are the three important milestones in case of female. So in all those milestones, if they are highly sensitive, theridion is a medicine that we could think of. So that will be the general feature, the two important keynote manifestation and how we connect it physically to other symptoms. And then in particular, we have head symptoms. And I told you in case of head also, they have head complaints from closing the eyes, which means there will be headache from lying down, like lacuses. And then we already saw that they are having sensitiveness to noise. So even when others are walking on the floor, they have aggravation of headache. So this would be the symptom you need to remember. There are other things like headache when beginning to move. That is one of the general symptom. Motion is aggravation actually, and they have explained the pain nature. It doesn't matter even if you don't remember it. Doesn't matter. But just see how the head symptoms have been connected to that two keynote features: aggravation from closing eyes, and also as if that sound is passing through it. So even when the person is having headache and she's just lying down, someone comes into the room or walks near to her, even that is enough to aggravate that headache. That much sensitive the patient will be. Then in case of back and neck, there will be pain in the upper left chest. So we already saw that this is a left-sided remedy. So in the upper left chest, so the left chest in the apex region of the lungs, there will be a pain, and that pain will be transferred or it will be transmitted via the scapula or even to the neck region. But this one, though we say left chest-sided pain moving towards scapula or the neck region, the medical condition we think will be usually MI or the angina. But in this case, theridion, uh, more than angina, it will be the tuberculosis related pain that is seen. Okay. Though, though it is the pain radiation, because in case of angina or the pain of MI, we always say, uh, when I say MI, you understood, na? It is the myocardial
yeah,
infarction. Yeah.
yeah.
So MI, we know that the pain in the central part of the chest, it may be radiating towards the left or towards the neck region, the jaw region, or even to the behind the scapula. So when we see the symptom, we feel like, okay, this might be MI. But for MI, the similar symptom, we have another spider remedy that is lacrodectus. But here, because we have seen this remedy is good for tuberculosis, this type of symptom, this pain will be affecting mainly the lung complaints. So if there is a pneumonia or even tuberculosis, and in tuberculosis, when it is in the secondary stage, it usually affect the apex region. Otherwise, in the primary stage of tuberculosis, if you remember the cavitation, everything that is either it is almost formed in the middle part of the lungs. We say like the cavity or that complex formation in case of tuberculosis will be either the lower portion of the upper part of the chest or the upper portion of the lower part of the chest. That's how we say the Gons focus when we say the position of the Gons focus, the primary lesion in case of tuberculosis. Now, if we forget all this upper and lower, it's somewhere in the region where the it is the bronchus that is opening into lungs, right? Trachea comes, it divides into bronchi, and bronchi enters into the lungs. So it
Okay.
is where the bronchi is entering. In case of primary tuberculosis, we have the lesion. But when it goes to the secondary type of tuberculosis, the cavity will be more seen in the apical part of the lungs. If you go and you check just the tuberculosis, you will see that in the secondary, the lesions will be in the apex region. So this symptom, I mean, you can just by heart this, but I'm just connecting it with the medical condition also. This symptom, though we feel like the pain from the left chest radiating to the jaw and this scapula, we feel
Mhm.
like the first thing that comes into our memory will be angina. But this is not CVS related. This is more related to the tuberculosis condition. So, if the tuberculous abscess or the cavity is formed in the apical region and they have this pain, or even it can be a pneumonia, the lobar pneumonia, no, yeah, lobar pneumonia, or even the yeah, pneumonia that is formed, but not pneumonia exactly. Pneumonia it can be lobar, the whole lobe will be affected and not even broncho because it will be disseminated. It's usually the tuberculous condition. When the apex that is affected and they have that pain, you can think about. And all the remedies that we have put in this comparison, that is anisum stellatum, myrtus communis, pix liquida, and sulfur, all these medicines, they also have affections of the left lung. So it is not though the term used in case of Theridion is left chest, and
Mhm.
when we hear that we connect it to the heart, no, the connection should be to the left lung. Okay, that's the simple thing I wanted to say.
Okay.
And all these medicines also. So if some question comes like to mention, all these are actually specific left-sided tuberculosis, anisum, myrtus communis, pix liquida, and even sulfur, tuberculinum. It is a specific remedy if the left lung is affected. So we have that theridium, and then pain in our bones all over the body as if broken, not so important. But we have the in the back and neck, the important one, the sensitiveness between the vertebrae. So sit sideways in the chair so as to avoid the pressure. And we have chininum sulph. Also, other remedies will be agaricus and zincum met, picric acid, uh, for this spine complaints. And here also we see that they are having aggravation from least noise uh, and jar of food on floor. So that noise is very great complaint for them. So remember this left chest or the left lung condition,
Okay.
and also this sensitive vertebra in case of pterygium. So aggravation, there will be touch aggravation, traveling in the ship, that is aggravation, pressure aggravation, riding, least noise, closing eyes, and then coitus. That is this, you can connect this one and then you can develop the whole drug actually. And amelioration will be warmth in general. The second one will be important one is tarantula.
Okay.
Tarantula, we have two remedies, Tarantula hispanica and Tarantula cubensis. If they just say tarantula, what they are intending is Tarantula hispanica. If it is Tarantula cubensis, they will be mentioning it directly as cubensis, Tarantula cubensis. If it is only Tarantula that is told, they are indicating the drug Tarantula hispanica. And in keynote, it is only Tarantula that is given. They have not given Hispanica, but as I told, when only Tarantula is given, they are indicating the drug Hispanica.
Hispanica. Okay.
And another book, I think in Farrington, they have not given the term tarantula alone. They have given it as Lycosa tarantula. So this is not another separate drug or another spider. This is the same. Lycosa tarantula also means Tarantula hispanica. So Hispano. That's the term used for Spanish people. So the common name will be Spanish spider. Preparation I told you, tincture of the living spider, except Tila areniara. Everything is tincture from the live spider. The characteristic feature is, in case of tarantula, they are highly poisonous, but not as poisonous as Lactrodactylus. Lactrodactylus can even kill the people. Even this can be, but it is poisonous. But the important feature is, when these people are bitten by this spider, the kind of treatment they used to do in the initial time was make the patient to dance very violently, so the person will produce sweat all over the body, and not like 5 or 10 minutes, for hours they make the patient to dance, a kind of dance mania. So that will ameliorate because the person will be sweating and then it produces amelioration. So Clark has mentioned two poisoning cases. One is the farmer I told you, and another is a young boy who got bitten. They were becoming dyslexic because of this spasmodic condition, spasms of the chest muscles or the respiratory muscles. They're having that dyspnea, and to ameliorate that, the music was played, and hearing music, they got interested or they got excited and they start dancing. And after violent dancing for hours, the patient gets wet and there was amelioration of all symptoms, or the poison will be leaving the body by that sweating. That's how they say that. And because of this dancing mania, or the person dances, it's a kind of treatment also. That was termed as tarantism, and the term was given as tarantula. And this feature we can see, while proving we got the symptom like the patient is having much amelioration from dancing and also music. Music is actually ameliorating this person. So that's the importance of tarantula and its poisoning. The constitution is, this is more suited for nervous hysterical patients, similar to what we saw in Theridion, and also choric affections. So chorea is also important feature, and the person will be very cunning, mischievous with a destructive tendency. They have ailments from fall, unrequited love. I doubt this is the spelling. Bad news, scalding, punishment, and also septic conditions. The guiding symptoms or important cardinal feature will be, they will be having purplish discoloration or dark red swelling of skin and tissues, which means this is a very good remedy for the blood poisoning symptoms. That's the abscess, furuncle, carbuncle, all those things, and that will be appearing purple in color. And when I say purple in color, do you remember any other drugs which is having that characteristic on the abscess, which
Purple,
is having which one?
purple absence of purple blood or skin.
Purple skin. Skin, yeah,
Lachesis.
yeah, lachesis is one. So that also, so another comparison with lachesis. No, that even already we saw that abscess is the, but then the even the appearance, that purplish blue color we have here. Uh, And then there can be imminent choking that can be related to the dyspneic symptom or the spasmodic symptom that it produces. They have chorea, amelioration from music. So music at first excites and then subsequently relieves all their complaints. Periodicity is the, I told you the poisoning, if he is not taking any preventive, the patient who had that history of biting from the spider, they will
Uh-huh.
be the complaints will be returning every year. So they in the even in our symptomatology we have got this periodicity, and here there is a different feature. There is amelioration from rubbing. This is a keynote condition of tarantula termina, and the sentence they say is, termini of nerves become so irritated that some kind of friction is necessary to obtain relief. So in the common symptoms, when we are saying, we saw that there is hyperesthesia. And I told you when the tip of the fingers also, it will be extremely sensations exaggerated, that they need to rub very violently, or a pressure
Okay.
is required to get the relief. So now when we compare this symptom to actually theridion, in theridion we saw that touch or pressure is aggravation. But in case when we come to tarantula, this pressure, when we are doing actually a rubbing, we are kind of giving small pressure. But that is amelioration in case of tarantula. Okay.
Okay.
So in theridion, the touch and even pressure was aggravation. But when we come to tarantula, that pressure or rubbing is highly amelioration. So now I'll go and
Okay.
say, because these differences, I told you when I was just starting, the differences of these spider remedies are actually so minute, so minor. We don't keep it for a BHMS question. It will. That's one reason, because now because you are very smart. That's why I gave you the difference, how it is differentiated. Otherwise, these points usually we discuss only during the the PG time only. Otherwise, we don't say to BHMS level students, because it's not that minute difference that should they should remember. Nothing like that. So so this is a feature. That's a very minute of fine differentiation between tarantula and theridion, which we can easily get confused also, because all other symptoms, even the chorea, the periodicity, the sensitiveness, hysteria, cunning nature, both the drugs have. But this one is a highly characteristic feature of tarantula. And then there is cough ameliorated by smoking. So that are the features of tarantula. So in mind, so now when we go and if you remember the common symptoms, we'll see that the patient actually had these symptoms of hysteria. We saw that the hysteria will be manifested only when people are watching him, and otherwise they don't show it. That's
Yeah.
actually the features of actually tarantula. So it
Mm.
is the individual feature of tarantula. There is no hysteria when no one is watching, and when someone is watching, they start to twitch, even going towards wild dancing. Means the whole body will be showing that choric movements. Then the mental symptoms related to hysteria, it can be anything. The sighing, yawning, laughing, crying, joking, profound melancholy, or even the least excitement, followed by languid sadness. I mean, any symptom manifestation of hysteria, it is everything related to sexual disorders. And we saw that these persons are highly nymphomaniac. Sexually, they are having high desire, but coitus is going to be aggravate this symptom. So that is actually a feature of tarantula. So in the persons, they have the hyperesthesia, the hysterical hyperesthesia. So hysteria in one way can be manifested that the patient getting least excited, or the least excited news can cause a anger or irritation in them. And followed to that, they will be showing that sadness, a kind of bipolar disorder. We can connect like that. And hyperesthesia, the great excitability of the nerve endings. The tips of the finger will be extremely sensitive. And here is where we need the symptom that the pressure is required to ameliorate that increased sensitivity.
Okay.
So sexual sphere, because we have connected it to the sexual disorders, that suppression to hysteria. You see that the desire is increased in both sexes to the point of mania. But coitus only aggravates the sufferings in both. Then pruritus valvae, it becomes intolerable, but it's not that important. Important will be this one, desire that is increased. And next, another important symptom you need to remember is during menstrual nisus, which means in the initial days of menses, the throat, mouth, tongue, etc. are intolerably dry, especially when sleeping. And another drug which have this symptom is Nux moscata, one of the very uh, dry medicine in homeopathy. Very dry in the sense, not in the particular form or the medicine form, but the patient, nux mosquita patient will be dry from head to foot, from internal to external. You can
Mm-hmm.
see when you study their symptom, you can see dryness is the key feature, externally or even internally, head to foot, everywhere there is dryness. So this symptom, usually I've not seen any patient saying this symptom. Maybe I have never met a patient, and I don't have much clinical experience also.
Mm-hmm.
But I have not seen patients saying this, that during their menstrual time they have this dryness. But this question is more important for an MCQ basis, because we have another drug that is Nux mosquito also coming and having the same symptom. So tarantula is having that symptom. So in sexual sphere, remember these two symptoms: this dryness and also the increased desire, but coitus aggravating. Then in the nervous system, we saw that there will be twitching, jerking, dancing, and all these choric movements only when people are watching them. And here it is right-sided. So in case of Theridion, we saw the left-sided affections, but here in case of Tarantula, it is right-sided. So this is yet another fine difference, the side differences. Or it can be whole body, or right arm and left leg are affected diagonally, right arm and left leg. Sometimes they may be showing that jerky movements of right arm and left leg. If you observe people, sometimes they will be showing that diagonal nature also. Then there will be this restlessness or that choric movement, which is more manifested in the lower extremities. And rest is aggravation for that person, and person wants to move about. But this moving can aggravate all the symptoms. So just imagine the situation of that patient. They're having highly restlessness, especially in the lower limbs, and rest is aggravating them. So they are not able to sit or lie somewhere. They have to get up and walk. And when they are walking, the symptoms are still aggravated. So imagine the situation where they are whether they will sit or they will walk. That will be the
Mm-hmm.
kind of restlessness that they feel. So this is a characteristic symptom which you need to remember, because there is no position or no particular attitude which will give them a relief. Rest is aggravation. When they move about, moving is aggravation. When they lie, that is aggravation. So no particular ameliorating position they could have because of this nervous complaints.
Okay.
And in spinal irritation, in case of Theridion, we saw that they don't touch the back of the chair, and not the back of the chair, on the chair. They will be sitting sideways so that the pressure doesn't come up. But here, it is not like that. A slightest touch is going to produce pain in the chest and the heart region. The neuralgia is characteristic. This neuralgia can be anywhere, but more prominently in the head. And in the head, the comparison is like this, as if thousands of needles were pricking on the brain. So this is more important like a MCQ. And
Okay.
amelioration will be by rubbing head against pillow. So in case of pterygium, there also we saw that there is headache, but that headache, I told you there is no need to remember the sensations and all, only connected with that sound aggravation. That is, the person is lying down, and even when someone is walking nearby, that is causing the aggravation, and also closing the eyes. And in case of tarantula, there is headache, but here the headache will be going to the general nature, that a pain sensation, as if thousand needles. I don't know whether the patient says like that or not. This is more important, like in MCQ, thousand needles that is being pricked into the brain. That's how the patient feels, and because that sensation, even here the patient needs that rubbing. So that rubbing sensation he needs in the tip of the fingers to reduce that sensitiveness, hyperesthesia. That is also required even in case of headache. So both the headaches are slightly different, which is another fine feature. That's why the question is never asked at a BHMS level. So in the case of Theridion, the aggravation will be from touch of affected parts. In case of Theridion, it was touch and pressure aggravation. But here, in case of Tarantula, touch is aggravation, but rubbing or pressure is amelioration. Then rest is aggravation. The patient must walk about, but walking aggravates all the symptoms. And even coitus is aggravating the symptoms. And amelioration will be characteristically to remember rubbing or even pressure and also music. Then we have Tarantula cubensis. Another name will be Mygale cubensis. Uh, this is Cuba, so Cuban
Mm-hmm.
tarantula. Venom is less poisonous and a very hairy spider. This one is more characteristically Korea, but Korea is left-sided. So we have the tarantula, Tarantula hispanica, where we had the Korea, and that Korea was right-sided. And here the Korea, the Tarantula cubensis, it is the left-sided. Another minute difference. But this remedy is more indicated in carbuncle. Now, when you take this book, actually, the Ellen Skinner, and you
Uh-huh.
see tarantula, all the symptoms we discussed in Tarantula hispanica, you will see in case of tarantula. And then you come towards the lower portion. The lower portion is about skin in tarantula in this book, okay? And though you can see the skin, the symptoms that I have given here, the carbuncle, abscess, phalanx, whatever these two symptoms, you can see over there in tarantula. Uh, how I want to say you is, uh, in case in case of this book, Alan Skinner, they club the symptoms of both drugs, of Tarantula cubensis and Tarantula hispanica. So,
Okay.
if it is the blood poisoning, the carbuncle, abscess, phalanx, etc., Tarantula hispanica can be there, but it is more importantly while proving we got it with Tarantula cubensis.
Okay.
So when they made this book, because it is keynote, and they just clubbed so many symptoms. In case of Tarantula, they clubbed the symptoms of hispanica and cubensis. But actually, the skin symptoms, whatever we say, that purple color, bluish color, atrocious burning pain, the carbuncle with the level of sloughing, prostration, diarrhea, and the pain compelling the patient to walk on floor for nights, specifically, it belongs to actually cubensis. So if I say you, for exam, it doesn't matter. You write it under Tarantula hispanica or Tarantula cubensis in the SMS level, we don't care because it is coming under Tarantula. And in keynote, actually, because it's usually keynote we say in back in India to study for BHMS level. We go to Boric only during the PG time. So at that,
Okay.
if you're going to compare this, I mean, you put it together for the exam, it doesn't matter at all. But always keep in your memory, the skin symptom is more specific in case of Tarantula cubensis. Okay.
Okay.
So we have the bluish color and atrocious burning pain. In case of this carbuncle, we do have this spider remedies, lachesis. And another important remedy, two important remedy will be arsenicum album and anthracinum. So anthracinum is actually the anthrax poison itself, which is a nosode. But in case of arsenicum and anthracinum, we have this burning pain, but the appearance. In case of arsal, it will be grayish or more dark color or blackish kind of appearance for the carbuncle. A gangrenous type, not the dry, the wet gangrene type, that will be
Mhm.
arsal. But in case of anthracene, it can be grayish like or dark color like arsal, or it can be bluish also. All these drugs, they have the characteristic burning pain. Even the burning pain is a feature of arsal, also in case of anthracene and also this drug also. Just finer points, okay? Finer points. Look,
Okay.
that's what I told you. And this pain that compel the patient to walk on floor for nights. And if we are putting it this symptom or studying under Tarantula hispanica, the patient, we have seen that the patient will be forced to walk, but walking aggravates the symptoms. So even though there is pain, compel the patient to walk, it is going to aggravate the symptoms. Then there can be intermittent fever, just showing the periodicity with evening exacerbation. Doesn't matter that much, just showing the periodicity. It's well that you have to remember there is tarantula hispanica and tarantula cubensis. The skin symptoms that we study in Allen's keynote under tarantula hispanica, actually it has come from tarantula cubensis.
Okay.
Then Mygale lasiodora was the another one, and the common name will be the black Cuban spider. Tincture is what we use. The characteristic symptom is the data of Mygale, that's the poisonous symptoms, the pathogenic data we got from two conditions. One is that was given by proving, though it was proving maybe they have given in higher doses. That is why the pathogenic data had come out. And another one was a poisonous case. So in poisonous case, they say about the inflammation along the lymphatic, so lymphangitis. And when we go to the symptomatology, we can see that this medicine can be given for lymphangitis. And the lymphangitis initially was a violet color, which changed to green color, along with that chill, fever, dry mouth, thirst, dyspnea, etc. With a fear of that. You don't have to remember all these things, okay? I just put the condition, and there was a proving and also poisoning condition, what was the manifestation. And when it was proved, we have the sum of similar symptoms like dry mouth is common in both dry mouth. And then here also there was palpitation, dim sight, great general weakness, but they had a characteristic symptom improving. There was increased flow of urine, hot scalding, and stinging in nature or stinging pain. And this symptom, because of that symptom, Mygale is usually given for gonorrhea, herpes, and also syphilis. So when we were discussing about the physical symptom, common physical symptoms, though we saw the action on kidney, and then we saw that there can be hematuria, and what was another symptom? Hematuria and kidney inflammation. What the term we used over there?
Good.
Albuminuria, the
Oh, okay.
glomerulonephritis. But it is not exactly that we see actually gonorrhea and syphilis condition because of their pain associated, either acute urethritis symptoms. We can rather go like that. So because of that, it can be given for gonorrhea, syphilis, and cordy. Cordy is actually the violent, excited uh, erection of penis. It will be very painful actually. So chorea is also a characteristic feature and also sexual symptoms. And in chorea, the most important feature is facial muscles. The chorea, which is seen in the facial muscles. So some of you are seeing right side, some of you are seeing left side. Even we come to over here, you see a right-sided chorea or convulsive motions. But if a MCQ comes like chorea or twitchings of the facial muscles or the facial nerves, Mygale is a very good remedy. So in conditions of Bell's palsy,
Oh, okay.
trigeminal neuralgia, this is a very good remedy. Facial muscles, or facial nerve infections, when there is twitchings and jerkings of the facial muscles, Mygale is a specific actually. That's why I put it in even in capital letters. So that's the chorea that is more important. So even if you forget, though I mentioned over here how you got the symptoms and gonorrhea and syphilis, I wanted to mention gonorrhea and syphilis and how it was connected to the physical symptom, the kidney. But even if you forget this symptom, it doesn't matter in whenever we say about Mygale, if you can just remember this symptom, the twitching of facial muscles, that alone will do. Even if you forget all the other symptoms, it doesn't matter. We just need you to remember this single medicine, a single symptom. So otherwise, it can be a right-sided one. There is constant motion of whole body because chorea is that characteristic. Facial muscles, but also other body. There will be uncontrollable movements of arms and legs, unsteady gait, limbs drag while walking. So any cerebral or cerebellar lesion where we have an unsteady gait and the patient lagging, dragging the limbs, we can think about this medicine migraine. Though it will be very specific for the contractions and twitchings in the face. Then also lymphangitis and the symptom of lymphangitis. That is why I connected to the poisoning history. And the sexual symptoms. The second principal symptom is the sexual. And in males, we see the violent erections, or scientifically, medically, we call that condition coding. And modality is aggression in the morning and amelioration during sleep, which is not that important. And then we have Lactodectus mactans, the black colored one. And because it produces angina pectoris or the MI, the typical MI, the person can die. So we can connect its common name to American black widow spider. Imagine someone's husband had come MI and she became a widow. Because the common names can be asked for MCQ. That's that's how I used to remember, because we had such a lot of spiders, and sometimes it is orange spider, Cuban and Spanish. Yeah, we will remember. But this widow spider, and then there is Arania diadema. Some other symptoms, common name comes. So that's how I used to remember Latrodactylus angina, person dying, and the widow is becoming. So black widow
Okay.
spider. And this medicine was introduced by these two persons, Jones and Tafel. So this is given for angina and hemorrhages. And hemorrhages, you see that blood is watery, which means it will be a non-coagulable blood, like that of lacusis, not easily coagulating. So in this one, we don't find any characteristic individual symptom. Whatever symptoms we see over here is actually the symptom of angina itself, or the MI symptom. So we'll start that. The precordial region, or it is the apex region of the heart, which seems to be the center of attack. There will be constriction of the chest muscles and the pain extending to axilla, down to the arm, forearm to fingers with numbness. And usually it will be the left-sided arms that is affected. So the pain in left arm, it feels paralyzed. The pulse will be feeble and rapid. This crampy pain can also move from chest to abdomen, and from the abdomen, it can even move from abdomen to the legs also, with a weakness of legs and also paresthesia, or altered sensations in the lower limbs. Then the skin will be cold as marble. So when we see all these symptoms, there is no characteristic symptom, no
Yeah.
characteristic individual symptoms. It's completely the symptoms of angina, and that itself is its feature. So if we get that common, because angina usually have that usual presentation, this is the presentation, and most of the angina patients, or the my patients, they are having this symptom. They don't have any particular extra features. Usually, all those sweating, anxiety, trembling, that pain, excruciating in nature, uh, that difficulty to take breath, the whole body feeling very cold. That's a characteristic feature, and that's what we get in laproductus. So one of the remedy we could give. So that is with Lacrodectus mactans. This one is Lacrodectus hasselti. So you can see orange color over its black back. So this name is also called as red back spider, or
Mm.
New South Wales black spider. May be found only in South Wales. I don't know. So this medicine is mostly, there are other symptoms, but I want you to remember only chronic blood poisoning, septicemic condition. It arrests pyemia, the pain in pyemia, and edema in the neighborhood of wound. But I don't want you to remember this medicine also. It is not important. Latrodactylus hasselti. I just mentioned because it is there in your syllabus. So I just mentioned that. And if at all you are remembering, I want only you to remember this chronic blood poisoning. Even therapeutically or practical wise, you don't have to remember in your future also, because we have another set of long remedies. We have Tarantula cubensis, arsen, and then anthracinum for these carbuncles and furuncles. We don't have to remember this rare remedy. But just because there is you can just put the chronic blood poisoning. Can be paralysis. The other one is Latrodectus catipo. So we have three Latrodectus, Mactans, catipo, and Hasselti. Out of that, it is the Mactans that is important, and the symptom is actually angina. So Latrodectus catipo, I actually referred it in one book. In Boric, it is given as calipo, but it is not
Oh,
calipo, it is catipo. I referred actually. So this is New Zealand spider and nothing much to remember, lymphangitis. Only because it is there in your syllabus, I'm giving you the symptom, doesn't matter. But this one is very important, Arrhenia diadema. This is going to help you clinically also. And this is a very good remedy, especially when there is heavy rain. And related to the heavy rain, if the patient is having cold and related symptoms, Arrhenia diadema is a very good remedy. So it is one of the Graugol hydrogenate constitution. We have seen this in case of Calcarea carb, then Talcamera, Thuja, natrum sulph. Like that, another important remedy is Arrhenia diadema. So the hydrogenate constitution uh, more indicated in intermittent fever or intermittent affections. And here, when we say hydrogenate constitution means there is abnormal sensitiveness to cold and dampness. The patient can't live near the freshwater, lakes, rivers, etc. They can't have any fish or any living, be it vegetable or non-vegetable, like fish or any type of living material from the river or water, any water body that is going to aggravate their symptoms or it will produce complaints for them. So even there is seaweed, some type of algae, even that will be problem. It is not the non-veg or a fish it's causing problem for them. Anything from water is going to be a problem for these people, so they can't live near. This gives the aggravation from bathing, from damp weather, damp localities or habitations, aggravation from drawing in cold air. Chilliness followed by lip chill or no fever. It's okay, you don't have to remember this. Just remember the dampness. And because in Malaysia also the rain is a big problem here. I mean, not a
okay.
problem, it's always there. The complaints follow to a heavy rain. Arrhenia is a good remedy. So it can be given because we saw intermittent fever and all. So they have this chill neuralgic attack or any complaint which is repeating at the same hour every other day, week, month, or during regular period, which means there is a characteristic periodicity. Attacks are very violent and sudden, and most of the symptom it occurs on the right side. So if you can just remember the side, when I say mostly all the remedies are right-sided. The left-sided one, when it comes to angina, it is the Mactons, Lactodactylus mactans, and the first one we learned Theridion, which is left-sided. Otherwise, almost all are right-sided remedies. Then this is a characteristic feature they have, or a sensation of swelling in many parts of the body. So I read in Clark that when the patient presented with this symptom, they had some other symptom, but they also had this sensation of swelling in many parts of the body. When this medicine was given, Arrhenia, it actually worked. So they have this scattering sensation as if swelling is present in many parts of the body, and also as if the bones were made of ice.
Okay.
Then pain like electric currents, not that important. It may be in actia racemosa that will be more important. The lightning like pain over here. Okay, just delete it off. I don't want you to remember this symptom. Then when this. So in case the aggravations, there will be damp weather. We can connect it to the damp nature and better from smoking tobacco. We saw that it is a common feature. We saw that in tarantula also, and now in Arrhenia. All symptoms of Arrhenia characterized by periodicity and coldness, always worse during rain. This is the features. Always don't forget about Arrhenia and its connection to rain. Then in case of relations, this I just liked, that's why I kept. So if there is any intermittent complaint, especially during hot climate, we have one remedy that is citron. And if it is
Uh-huh.
the intermittent complaint during the cold climate, it is anemia.
Okay.
Finish by that. Because the last time I couldn't get add to. I usually follow a pattern. That's why just editing it into my usual style. Ah,
Yes, please.
I was just coloring it. Just wrongly selected the thing. Okay. So we'll finish the spider ducks. And tomorrow, probably I will start with this sepia
Okay.
murex and spongy. And tomorrow, when shall I take your class?
Is 9 okay?
9. Can you make 9:30?
9:30. Okay, 9:30 is fine.
Because I can have breakfast. That's fine.
Okay.
9:30. Or if I'm finishing early, we can start even 9:50.
Okay.
I message you. Did you take the screenshot?
Yes.
So, see you tomorrow.
All right. Thank you.